So, good morning, everyone, and thank you to everyone for doing the right thing. Before we start, out of the 34 states on quarantine list, Rhode Island was added, and D.C. and Delaware were taken off. So, just to let everyone aware of that. So, as of today, we have 2,322 positive cases of the COVID-19 in Albany County. 580 people under mandatory quarantine. That's an increase of 12 positive cases since yesterday. Almost all the new positive cases, we know that 2 are healthcare workers, and 6 have close contact to positive cases, and 4 didn't have a clear source again. There are 37 active cases in Albany County. 7,625 people have completed quarantine, and 2,285 tested positive for the virus have recovered. That's an increase of 6 from yesterday. There are now 2 people hospitalized with a hospitalization rate of 0.08% of those who have tested positive. Yesterday, the rate was the same at 0.08%. 1 currently in the ICU, and so one of the things we've been looking at, and we're trying to figure out where we're at, and as we see the numbers go up, they go down, and you go almost 6 months ago when we got 1 or 2, it was a big deal, obviously, and when we got 6, 8, and steadily we're either between 12 or 8 new positive cases each day. Yes, we are trying to be more aggressive with the testing. But as Dr. Whalen showed yesterday on the board, that the testing wasn't at the high level it was, I believe, a month or 2 before that. So we are encouraging people to please go out and get tested. If you look at the percentage rate positives across the state, in our capital region, Friday we're at 1.1%, Saturday 1.0%, Sunday we dropped down to 0.9%, and Monday was 1.1%, and Tuesday was 0.9%. So yes, the virus is still here. The million-dollar question we get all the time, and when I talk to the control room, is, are we going to reopen? Are we going to get back to some type of normalcy, and how long is it going to take? I can't sit here and tell you that I'm the expert. I'm not. I only just, we have to take our guidance from the state. We have to take our guidance from the CDC, from the health experts that are out there, and try to open up in a way that an infection rate doesn't go up. And that's what the governor's trying to do, trying to control the rate so we don't get to the point where other places had to shut down. Are we being more cautious now than other places? Probably. Do you get to the point where this is the hospitalization rate? And I said this yesterday, and I said it the day before. Can't explain why we're not having that high hospitalization rate, why we don't have as many people in the ICU. I'm glad that we don't. I thank God every day that we don't. But what point do you get to where you say, okay, this is manageable, we have to get back to some type of normalcy? And I said this 6 months ago, that basically it's a new world out there. We had to reimagine what the workforce is going to look like, what everything in life's going to look like. But it comes to a point where we have to give it a try and get back, because we don't want a setback. And I get people, I know you're tired of this, you're over it. I get it. 6 months, it's been hard on a lot of people, especially the essential workers. I got our health department, our epi people, our people down at the mental health and health that have been around the clock, our DCYF workers that have been coming to work every day, our DSS, our nursing home staff, our sheriff's deputies, our jail personnel, our sewer districts, that DPW, who's done a great job, probation. I could just go through the whole list, the security, the cleaners. Everyone's tired, and I get it. And temperament, I'm seeing, is getting a little bit more higher than I've seen 6 months ago, and it's kind of surprising because we've been open up for a while, but I think people feel like the prison door was just opened up a little bit, and it's not opening up enough to let them feel their freedom. Listen, I've said it, and I'll say it again. It's a marathon. It's not a sprint. We have to crawl before we walk, and we have to walk before we run, and we're kind of just starting to walk now. We're finding our legs, and before we start to sprint, we have to make sure this is done rightly, because the last thing I can assure you, myself and Dr. Whalen, don't want to sit here and tell you that we have to start closing things down. People are going to the hospital. I'm not going to argue with the people that, about the flu and numbers and this and that. I think I've been pretty clear. I should say this to the gentleman on Facebook. I am not the expert. I just take my guidance. We do what's right. Dr. Whalen and I try to go through everything. We siphon through stuff, and we try to give out the best guidance that we can going forward. And that's all we can do, because we're in this together, and we'll get through this together, instead of pointing fingers. And I mean that. That's one of the reasons why we sent up the mental health hotline the second day. I knew people were going to need to call somebody, and don't feel ashamed or embarrassed to say that you just want to talk to somebody. Life is different. Wearing masks is different. Not socially distancing and not being able to walk around freely is differently. It's one of the things maybe everyone should take a step back in this country and realize that freedom isn't free, and think of other countries where they don't have the freedoms that we have. And if you look at the policies that are being put in place for masks around the world, I think Thailand's going to charge you $5,000 if you are up to $25,000 if you don't wear a mask out in public. Hong Kong, all of them, or Japan, they're like putting seriously fines down if people come out in public without a mask. I'm not suggesting that here, so please take a deep breath. That's not what we're saying. But again, it shows you the seriousness that we're dealing with, not just here in the United States, but in this world. But again, enjoy what we have, and we'll get there together, working together, not pointing fingers at one another and blaming one another or getting angry. I wish I could hug you. Here's your virtual hug for everyone, okay? Buddy back there you go. I'm going to hug you away. And, I know we can't. I know some people miss that. So please, we'll get there again. Hopefully we will, sooner than later. So our last 5 days average has been 8 new positive cases each day. Yesterday it was 8.2, so going down. The governor said he has, if we have any concerns or you're worried about anything, get tested, whether he has symptoms or not. I think on, I don't know if it was the Times Union or our Facebook, that people are commenting on how they don't ask for insurance at UAlbany. It's seamless. You go through there, you set up an appointment. They have it down, people. They have it down. So please go get tested. It's not going to hurt, especially with school reopening up. I had a lot of questions from parents. And I'll leave that to, I should have said this to Dr. Whalen before. What's the appropriate age? And I know we talked about that, so I'm going to let you talk about that. Some of the parents want to know what's appropriate. Can I bring my 13-year-old to get tested? Can I bring my 15-year-old? And I said, that's a good question for Liza. So, but these are questions that people are wanting to know. I've talked to school teachers, and yes, I'm hoping the governor and the schools are listening to the school teachers that are in the classrooms. They are the ones in the classrooms that got to work it, so hopefully their guidance was put into all this of reopening up. Again, I will say to parents, if you're uncomfortable, do Zoom, and I think that's where it's going to go. Your children are going to have an option. I think Holy Names is doing that, Academy, Catholic Central, or like giving parents the opportunity, and for the teachers too. So as the teachers in the classrooms too that have to wear a mask all day, so what's the protocol going to be? How are you going to isolate it and stuff like that? So as this time goes on, we'll realize it as we move forward. But again, if you want to get tested, go to UAlbany. You can call the number 1-888-364-3065. Also, we still have our mobile testing sites up and running, so please call that number, 518-465-4771. Rite Aid in Colony, as always, go online to riteaid.com, and location's up by 155, so you can go there, or Purdy 1 in Guilderland, as always, area code 518-867-8040, and just remember, it's 4 simple things: wear your mask properly, cough into your arm, clean your hands, and socially distance. I know I repeat it every day, but we have to learn that, right? So please continue to do that, to wear your mask out in public and do the right stuff. Like I said, I've been out and about, and I do see people, going in the stores, coming out without a mask on, or they put a handkerchief up to their face. That's not going to help. Again, think of the workers. I feel sorry for the workers that now are going back to work, and again, think about them. Think about them. They have to go home to their families, to their loved ones, to their kids. So think about that as we go forward. Again, please do. So in case you missed it yesterday, like I said, Cuomo added the 2 Rhode Island to the list of self-quarantine for travels for 14 days. And again, he took D.C. and off, and Delaware off the list. You can find the full list on New York Forward website. Please go to that. The other question we keep getting from essential workers, the governor said it, that if you're an essential worker, you can go back to work and you don't have to quarantine. I know that's been an issue, but again, look, I know people are planning vacations. If them 34 states are on there, pick someplace else to go. There's a lot of beautiful places here in New York State you can go to. The new state park that opened up, Westcott Park, I think it is, up by Watertown. New cabins the state just opened up. They're brand new. I suggest you go this weekend. I know someone going this weekend, so you should go there and enjoy it. But again, there's beautiful places here that you can go to and don't have to worry about quarantine. But it's a question that keeps coming up with unions and workers. Do they have to quarantine? Do they get paid when they come back after being away for a week? And then, so these are questions that have to be addressed. But I will say to the workers, and I will say to people in general, be smart. I know you're going to be going to places and you think, well, I'm going to stay away from everyone and do the right thing. But why even go to a hotbed, and why take the opportunity of bringing it back here as we have things under control? And if you want to get to that point where we're fully opened up, you got to be part of the solution, not part of the problem. So these families that want to go away, I get it. Plan a vacation 6 months from now. Plan it down the road. Do it then. Don't do it now. Help us get through this, and we can get through this together. But I do want to have Dr. Whelan say a few things.
Thank you. So we are seeing our numbers relatively steady in somewhere between 8 and 12 cases a day, and we continue to monitor that on an active basis. As I've discussed many times, we do very vigorous case investigations with each positive case to ensure that contacts are identified, that they are placed on quarantine, and that they are recommended for testing. And this is really the best way we know how to stem further spread of infection, along with the behaviors that we discuss on a daily basis here. When we say that the numbers are manageable, they're only manageable if people do what they need to do, if people do their part, wearing their masks, keeping social distance, avoiding large gatherings, and following guidance. In terms of testing, anybody of any age can be tested. If it is a child under the age of 18, they will need to be accompanied by a parent. And if you want further information, it depends on where you're going to be tested. Our website, the county's website, and the Department of Health's website outlines all the places in Albany County that you can be tested. All of these places you really need to call and get an appointment so you can get information on what to do if you want to bring a child for testing. I know I have 2 children that are 18 and 19 that are going off to college, and they went and did get tested out at the SUNY site in anticipation of going back to start college, and said it was a seamless process. The 2 of them drove out together, got their tests, came home, and they were thankfully notified they were both negative. So this is something that they felt they wanted to do. They wanted to make sure that going off, one of them has to go into quarantine for 2 weeks when she gets there, and the other will probably be tested on his campus when he gets there. Different colleges have different recommendations, so if you're sending your child back to college, it's important to look and see what the policy of that college is. If you are going to be bringing your college or your child to a college in a state that is currently has a quarantine recommendation, please know that if you stay for longer than 24 hours, you should follow the quarantine recommendation when you get back. In terms of the essential worker classification, there is a classification that if you come back from a high-risk state and you are an essential worker, there's a modified quarantine. First of all, the essential worker quarantine or the essential worker categorization really means that your business says that they cannot function without you being there. And the business is then incumbent on them to do screening, make sure that on a daily basis you are assessed for symptoms, and you will be followed by the state's contact tracers on a daily basis. When you're outside of work, you should be on quarantine. You should be at home. You should be, if you are an essential worker, that means you go to your job, you are masked, You keep distance from people where possible. You follow guidance, get screened for your temperature, screen for symptoms, do what you do at work, and then you go home. But you should be outside of work within the same quarantine environments that individuals who are non-essential workers be on. So you are still under quarantine. I just want to be clear on that. In terms of younger children, many children have been home for months and months, and if you are sure your child hasn't had contact with others, it isn't necessary to consider testing. And of course, we always at the health department advise parents to contact their pediatrician for more information and thoughts about testing, but we at the health department also have nurses in a call center that can help provide guidance if you are considering that, so please don't hesitate to reach out.
Thank you, Liza. And and I don't know if you said this, one of the other questions we kept getting is, yes, the governor clarified, if you're at one of these states, these 34, less than 24 hours, you don't have to quarantine for 14 days. No, I can't answer that. I keep getting the same thing. You can't get it in 24 hours. Yes, you can, but that's the rules that they have. And again, it's their rules, not mine. So if you're there less than 24 hours, you don't have to quarantine for 14 days. Please also want to remind everyone, our mental health hotlines there are available 7 days a week, 8 a.m. to 5 p.m. Please call with any concerns that you have, anything bothering you. They're there for. It's a free phone call. They will listen to you. No, we're not going to lock you up. No, we're not sending people to your house. They're there to help, and they want to help you. So if you need to, call 518-269-6634. As always, our 24-hour sexual assault hotline, 518-447-7716. As always, the 211 number in the New York State hotline number, 188-364-3065. Again, we're going to get through this. We're strong here in the capital region, and we're resilient. So please continue to do the right stuff, and we'll all get through this. Stay healthy and safe. Thank you.